We appreciate that starting treatment can be a difficult time both for you and your family. We're here to reassure you and to take you through every step of the process. There will be a lot of information about treatment in this DVD, and you may find that you want to watch it more than once.
Good morning, Susan Squire.
What we're going to do in this film is we're going to take you through a lot of general information, some practical information about how treatment's delivered. We'll go through some very specific information about treatment and side effects, and really take you through the journey from when you arrive in the door to when treatment will begin. Your doctor will have checked that you are well enough to receive treatment for your cancer. There are many different forms of systemic anti-cancer therapy, or SACT. These include chemotherapy, immunotherapy, monoclonal antibodies and oral treatments, which may be oral chemotherapy or forms of targeted therapy. Treatment may be given as one drug or sometimes several drugs, and are often given in courses of treatment known as cycles.
Your treatment will be given on the Beacon Day unit, mobile chemotherapy unit, or one of our specialist inpatient wards. A small number of patients will be able to have their treatment at home. For patients having oral anti-cancer treatment, depending on the drugs prescribed, these will either be issued at Musgrave Park Hospital or delivered to you at your own home.
Not too bad, bit of a chesty cough. But
Chesty cough. Have they given you anything for that?
yeah, got some links.
Yeah, those helping?
And you are taking your own tablets and you're on top of them and understand what's going on?
Yeah.
Yeah, we haven't confused you.
Car parking is available in the multi-storey car park opposite the Duchess building. There are also a limited amount of disabled bays outside the Beacon Centre for those patients who hold a disabled badge. You may be eligible for hospital transport to and from your treatment appointments. If this is something that may be helpful for you, we would recommend that you contact the Patient Transport Advice Centre, who will be happy to discuss your needs.
We recommend on your first treatment that somebody drives you here, and that's because we don't know how you're going to feel on that treatment day, and you also may be given some medications that make you feel a little bit sleepy. That person that drives you is welcome to come and stay with you throughout the treatment, but we would ask that you only bring one person with you due to the lack of space. We would recommend that you have a dental checkup, and this is just to make sure you haven't got any problems with your teeth before your treatment starts. You may also be given some medication to take before your treatment, and it's really important you take these as your doctor or nurse has directed, and we usually give these to try and help with any side effects that you may experience. We recommend that you get a digital thermometer and that you try using it before you attend for your treatment, just so that you're familiar with how to use it.
Some patients need to have a blood test again before they start their treatment, especially if it's been a while since they've seen the consultant. That way you've got up-to-date bloods before you start, and we know it's safe to go ahead and proceed.
On the day of your first treatment, if you come to the Beacon Centre and check in at the main reception, and then make your way down to the Beacon Day unit where you can just have a seat. If you're having your treatment on Ward 9 or the Beacon ward, you can just make your way straight there. Once you arrive in the day unit, your allocated nurse will come and collect you and take you down to the treatment area, where they'll explain the treatment you're having, the length of time it's going to take. On the day of your treatment, you can eat and drink normally, and when you're on the day unit having treatment, we will also supply tea, coffee, biscuits and snacks. But if there's anything particular that you want to eat or drink, please bring that with you. We'd also recommend that you bring something to entertain yourself, either a book or an iPad or something, because some people will be here for treatment for quite a few hours.
You'll have a nurse allocated to look after you whilst you're in for your specific treatments. If you feel unwell or you need some attention while the nurse is away, perhaps attending to another patient, then you'll be given a call bell so you can get some attention if you need to. We have plenty of toilet facilities on the Beacon Day unit, and if you do need to use that while you're here, you have a mobile drip stand so you can access a toilet should you need to.
Anti-cancer treatment can be given in a variety of ways. This may be orally, by tablet, liquid or capsule, intravenously into the vein, or by injection. When given intravenously, treatment is normally given through a small plastic tube inserted into the back of the hand or the forearm. This is called a cannula. The cannula will be removed after each day's treatment. For some intravenous regimens, or where patients' veins are more difficult to access, a PICC line will be required. A PICC line is a long, thin plastic tube inserted into the upper arm. This will be removed at the end of all of your treatment courses. If you require a PICC line or any other type of central venous access device, for example a Hickman line, then this will be discussed with you by your doctor or nurse.
Once anti-cancer therapy has started, you will be seen in clinic before each of your subsequent treatments. These appointments are called pre-assessments and will be held in the Beacon outpatients with either an oncology or haematology doctor or a specialist nurse. You will need to have a blood test before your appointment, and the result will need to be available for your doctor or nurse to review. It is ideal for you to have your blood test at your GP surgery the day before clinic. You can come to clinic early to have your blood test before your appointment, but you will need to allow an extra 1 to 2 hours for your blood to be taken and processed so the result is ready for your clinic appointment. Side effects of treatment and blood tests will be reviewed at the time of your appointment, and changes will be made to your treatment accordingly. We will give you a treatment diary, as you may find it helpful to write your side effects down as they occur so that you can remember to tell us about them at your pre-assessment appointment. Treatment will then take place 1 to 2 days following your clinic appointment. Although we try to be as helpful as possible with appointment times, we are very busy and changes to schedules may not be possible. Clinical research is a very important part of improving treatment for cancer. We are an active research centre and aim to have a clinical trial available for as many patients as possible across a range of tumour types. If you are potentially eligible to take part in a clinical trial that we have open here at the Beacon Centre, we will discuss this with you in clinic and offer you the opportunity to participate. Participation is entirely voluntary, and we appreciate that this is not for everybody. If you think you would like to take part, we will provide you with written information and introduce you to the clinical trials team. Once you have had a chance to learn about the study, you will return for a consent appointment and then undergo some screening tests to ensure that you are eligible. Eligibility for clinical trials is very strict. We have a large portfolio of clinical trials at the Beacon Centre. Some of these are related to potential new cancer treatments, and some are related to other aspects of your cancer, such as quality of life. We very much encourage participation in clinical trials, so please do ask us if there is a study that may be suitable for you. It is important to remember, though, that taking part in clinical trials is entirely voluntary, and your standard treatment will not be affected in any way if you feel that this is not right for you.
Anybody that has a diagnosis of cancer or their closest families can access the service. You'll come and have an appointment to have an assessment to start with, and then we usually offer you an initial 6 appointments. If you need more, there are more. Alternatively, it might be that you would like to access a crisis appointment slot, which we keep Thursday mornings free for, and you would have a 30-minute session. There's no shame in coming for counselling. All people come, young people, older people, men and women. You know, it might be something you've never done and you never think you're not that sort of person that does that. But I think generally people are quite surprised by what they find when they get here. It's not what they expect. So just, you know, a friendly face and somebody that you can just be completely yourself with. You don't have to worry about what I'm going to think. You know, like we hold back in front of our families. So it's that benefit of having that impartial, non-judgmental viewpoint and perspective. You know, you don't have to fear about upsetting others. So it can be useful from that point of view.
Of course, these treatments do have side effects, and your consultant will have gone through these with you at your consent appointment and provided you with written information at that time as well. The specific chapters of this DVD will go through the specific side effects in some detail for you. It is of course important to remember that not all patients experience all side effects, and you mustn't worry about this. You will have a 24-hour number to call us, and we would encourage you to call the Cancer Helpline number if you are experiencing any side effects. It's much easier for us to help you with these if we know about them sooner rather than later. It is not possible to go through all potential side effects of anti-cancer treatments in this DVD. We will be highlighting some common and some serious side effects. Please also refer to the written information that you have been given in clinic and do not hesitate to ask questions.